We've got all hands on deck in the governor's office. Our first thought every day is around public health. We want to make sure that as many people as we can and spare from getting COVID-19. We want that to be our first priority. For those that have it, we want to make sure we're prepared and that we have treatment and comfort. And we also want to make certain that the folks on the front line, our doctors and nurses and emergency medical personnel, have everything they need. And that's the gloves and the gowns and the masks and the ventilators. So we've got a surge mentality in terms of making certain that we've got everything, including hospital capacity, if needed. And right now, so far so good, but we're preparing for any situation that can happen in the upcoming weeks and months.
The unfortunate reality is that today this virus is spreading across the entire state of Washington. And its method of transmission is simple. It is person to person. And whatever we are seeing in Seattle today could be in Walla Walla fairly shortly, in Port Angeles, in Centralia. And so it is very clear that all of us really need to bend our shoulders to this task to save the entire state of Washington. The virus's devastation in some parts of our state is the kind we're desperately trying to halt in the rest of the state. So it is crucial that each and every one of us across the state maintain the social distancing that we know is our only weapon against this scourge. We are only in the first 2 weeks, and people need to understand this. This order may need to be extended. And the reason is we simply cannot allow this virus to be slowed, but then spring back upon us. We've got to pound it, and we've got to pound it till it's done. And I'm glad that Washingtonians are pitching into what is really a warfare against a fatal disease in our state.
My case tonight to Georgians is if you will help us stop the spread, continue to fulfill the 15 days that the President, the Vice President, and the National Task Force to stop the spread. We've got a few more days to go. We have about 10 days to go on the recent action I took. There's a lot of great things going on at the local level. If we can get our citizens to follow these directions, it will absolutely turn this curve. We can get on the other side of this virus, and it's critical that we do that for our healthcare system.
I also want to remind people that as we expand testing, and our public health labs are expanding their testing, we're seeing other organizations being able to expand testing, we will expect to see that we have got more cases, right? So the number of cases, of confirmed cases where we test somebody positive for coronavirus will go up. That's not going to be a surprise. We expect that. That's going to be part of what happens as we do more testing.
Yes, we're doing more testing than we were 2 weeks ago, but no, we do not still have enough tests in order to do the robust kind of data collection that we should be. And so we're going to continue to see this number rise because it's been here for a while. It's been passed from person to person. The social distancing that I've ordered through the Stay Home, Stay Safe order, we won't see the benefits of that probably for 2 weeks. And that's why it's so important that people do it. In New York, Governor Cuomo had pointed to a few areas outside of New York City where social distancing has leveled off the number of people that are being detected with COVID-19. That's what we are shooting for. We've got to give our health systems a moment so that they can build out and meet the needs and get the PPE and build up our testing capacity. And that's why it's so important that every one of us does our part and stays home and really dramatically decreases the number of trips we're even making to the grocery store.
People say to me, you know, people are getting tired of this situation. They've been home, it's going on a couple of weeks, they're getting tired. Well, the truth is that this is not a sprint. This is a marathon. We always said this is not going to be over quickly. I understand people are tired, but I also understand that people in this situation are really stepping up to the plate and are doing phenomenal work. So the next time you feel tired, and believe me, I feel tired, but when I feel tired, I think of the first responders who are out there every day showing up. I think of the police officers. I think of the firefighters who are up there every day, the grocery store workers who are working double shifts just to keep food on the shelves because people are buying so much food because they're nervous. The pharmacists who have lines going out the door and they're showing up every day, day after day. The transportation workers who don't have the luxury of feeling tired because they have to get up and they have to drive the bus so the nurses and the healthcare professionals can get to work. And those healthcare professionals who are dealing with a virus that they didn't even understand, they still don't understand. And they're there working, many of them 7 days a week. So yes, we're tired, but look at what others among us have to do and the challenge they're under and how they are stepping up. And who am I to complain about being tired when so many people are doing such heroic efforts?